Hello, this is Melvis Mako. I'll be presenting on major depressive disorder. This is a mood disorder characterized by persistent depressed mood lasting for at least 2 weeks. It affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. Things that will increase your chances of developing depression will be family history and genetics. It is more likely that you will experience depression if someone in your family, such as father, sister, or brother, has experienced it in the past. Stressful life events. It could be loss of a loved one, maybe father or wife, or even starting a new job. Being female. Personality traits. If you exhibit certain personality qualities such as poor self-esteem, or excessive self-criticism, you may be more prone to depression. Substance abuse. Individuals who are unable to control the use of substance have increased chance of depression. Chronic medical condition will be any condition that lasts for more than a year and requires ongoing medical attention or limits the individual's ability to carry out activities of daily living. Early childhood trauma could be childhood rape, would increase people's chances of developing depression. Areas of the brain affected are prefrontal cortex. This regulates role in executive function and emotional control and memory. The limbic system, made up of amygdala, hypothalamus, and hippocampus. This regulates activities such as emotions, physical and sexual drives, and the stress response, as well as processing, learning, and memory. Thalamus. It relays sensory and motor signals and as well as regulation of consciousness and alertness. Anterior cingulate cortex regulates heart rate and blood pressure. Neurotransmitters involved in depression are serotonin, norepinephrine, and dopamine. Scientists claim that abnormalities in these neurotransmitters might cause depression. Patient profile would be Nicole Peters, a 36-year-old female Caucasian diagnosed with major depression. She's a single mom with those support, lives in an apartment in Regina. This patient has had several admissions in the inpatient unit over the past 5 years. Comorbidities are obsessive compulsive disorder, substance abuse, and social anxiety disorder. Nursing process. Two quotes to exemplify the nurse is using therapeutic technique would be, you've mentioned many things. Let's go back to your feelings of ending it all. This is therapeutic communication technique of focusing. You're bringing the patient's attention to a particular aspect. The other one is, I'm not sure what you mean when you use the word worthless. This is clarification. Whenever you're not sure of the meaning or of what the patient is saying, is necessary or very important to clarify with the patient. Nursing diagnosis for this patient will be risk for suicide related to feelings of helplessness and disturbed thought process as evidenced by poor decision-making skills, inability to do activities of daily living as normal, confusion, and disorientation. Treatment goals for each nursing diagnosis. For risk for suicide, the patient refrains from attempting suicide. For disturbed thought process, the patient will be able to regain appropriate mental and physical functioning. For interventions, for risk for suicide, the nurse will encourage patient to express her emotions and think of creative solutions to deal with anger and dissatisfaction. This could be like behavioral therapies like meditation, journaling, or any other technique. For disturbed thought process, assess the patient's level of confusion. If needed, rearrange the patient to time, place, and person. The failure to sustain orientation is an indication of decline. Evaluation for risk for suicide. Patient expressed her emotions and devised alternative strategies for handling challenging circumstances. For disturbed thought process, patient was oriented to place, time, and person. Treatment goals, treatment outcome to indicate this patient is ready for discharge would be for risk for suicide. Patient would identify 2 outside support she can call if she feels suicidal in future. So it's very important for the patient to be able to identify services that they can reach out to if they're having those feelings of suicidal feelings or feelings of worthlessness. For the step thought process, the patient cooperates and engages with fellow patients and staff on the unit in an appropriate manner. Usually, patients with depression are always most often withdrawn. So, if they're cooperating with fellow patients and staff, indicates they are ready to go back to the community and interact with one another. So, for psychotropic treatment, I chose sertraline, which is a selective serotonin reuptake inhibitor. So SSRI are usually first-line treatment for depression because they have lower side effects. So for patient teaching will be make sure it may take a few weeks for you to see the benefits of taking this medication. SSRI usually takes like 4 to 6 weeks for individuals to be able to see the effects of the medication. Notify healthcare provider immediately about thoughts of suicide, worsening depression, or sudden changes in mood. Do not suddenly stop taking sertraline unless directed to do so by your doctor. May cause sexual dysfunction or lack of sex drive. Inform your healthcare provider if this occurs. Report any fever, rapid heartbeat, elevated blood pressure, hyperactivity. This may be signs of serotonin syndrome, which is very deadly. May cause insomnia, anxiety, and nervousness. Inform HCP if this occurs. Never mix with other antidepressants, especially MAOI, or any other over-the-counter drugs or herbs like St. John's wort. This may cause increased serotonin at the synaptic cleft and may lead to deadly syndrome. Wear sunscreen or protective clothing to prevent photosensitivity. So for community resources, we have the Caring Place Regina. This group provides a safe place for individuals to get together and support one another. And we also have counseling services, which offers a variety of counseling and treatment options to help you enhance emotional health as well as well-being. Family Service Regina. It provides quick access to short-term mental services for individuals suffering from anxiety, depression, substance misuse, suicidal thoughts, and stress. Crisis intervention. We have mental health clinic community outreach and support team. This is a multifaceted strategy for stabilizing and assisting individuals in the community who have been diagnosed with mental health and addiction issues. Equally have the Regina Mobile Crisis Service, which is a suicide line, which individuals are encouraged to reach out or call if they're having like suicidal thoughts or any other challenges. So this is the end of my presentation. Thank you for watching.